Congressman, one last thing. We're not going to let you off the hook on this. This is a story that every year it gets lost when the Medicare and Social Security trustees report comes out. Here we found out yesterday, Social Security and Medicare face depletion within 17 years. For the Medicare main hospital fund, it is 12 years, 2029. When are y'all going to get on the stick about fixing this?
Well, this is what a lot of us in the House have talked about. We've asked our Budget Committee Chairman Black to increase the reforms that she proposes for mandatory spending. We can't really get our fiscal house in order in America until we face the 3/4 of the budget that are in mandatory spending. And so we do need to make more reforms there. And in my view, that was one of the good things about the House bill, is it reformed the long-term Medicaid budget, shifting it back to the states, creating more innovation to save money at the state level. And those are the kinds of reforms that we've got to make if we want to have our fiscal house in order for the United States.
Yeah. Fair enough. Fair enough. We'll see how much actual Medicaid reform comes out of this health care revamp, if it ever moves in the Senate.
Because we know what has gone on with Medicaid, Congressman, right? I mean, characterize for us the last 10 years. What happened to Medicaid?
What happens to it I'm sorry, I missed that first part of your question.
In the last 8 years, what happened to Medicaid? Characterize what happened as this program has expanded and included more than just the impoverished, the blind, and the pregnant.
Right. Well, we've expanded Medicaid under the Affordable Care Act to way beyond the congressional intent of what the Medicaid program was for. Our poor, our kids, our developmentally disabled. And we've extended to able-bodied working people with no requirements that they work or seek work or do volunteer work. And that is, again, one of the reforms in the House bill was to offer our governors the ability to have that flexibility to have work requirements.
Right.
Something that we've seen be very successful in the reform of our programs for those who are most in need.
These are the kinds of situations, though, where the messaging becomes that much more important. Right, Dagan? We talk about the messaging and the Republicans trying to communicate what they're trying to do. And if you're looking at Medicaid slowing down the growth, yes, it's slowing down the growth for good reason. This program has expanded tremendously, but you need to explain that to the American people, because the Dems on the left are going to Congressman basically saying, you're cutting off people's Medicaid, here are the numbers. You need to message that. Are you doing that sufficiently?
I think we can do a much better job. We are slowing the growth of this program and making sure the program is helping the most vulnerable, the people that the program was designed for, and we're listening to our governors about how to design flexibility to give them the ability to create Medicaid programs in their state that are unique to the state, unique to their population and their challenges.
Well, I think that's the next challenge, sorry, Maria, is that, you know, Congressman, you have to think about, too, you got to talk more about the states and about their responsibility here, because I know, being in Illinois, as my home state, that's where a lot of people are worried about the states taking over a lot of that responsibility because they're worried about the state's capabilities, frankly.
Exactly. Congressman, we're going to see you soon. We appreciate you joining us this morning.
Maria. Thanks.
Thank you so much, Congressman French Hill. That's